All right, I think we're set. So thank you again for joining us today. My name is Nicole Dutra. I'm a senior project coordinator for the National Environmental Health Association, and I will be your moderator for today's seminar. Allow me to quickly review the agenda for today's Campus Grand Rounds. To begin, I will review the learning objectives for today's seminar. I will provide a brief announcement. I will introduce our expert speaker who has a great presentation planned for all of you today. We will hold a short Q&A session after the speaker's presentation for any audience questions. Then I will introduce our panelists who are going to share with you a day in their life working in food safety. Following that, we will hold the main discussion and Q&A session. And lastly, NEHA's Adrian Gothard will address all students with an opportunity. Then I will close out today's seminar with some final announcements. With that, allow me to cover a few housekeeping items before we get started. Please note that this seminar is being recorded. The seminar recording will be uploaded onto NEHA's Environmental Health Grand Rounds webpage. You can also find recordings for all of our previous seminars here as well. We will drop the link in the chat for you in just a moment. Please use the Q&A option on your screen to submit any questions that you have for our speaker and panelists. You should see the Q&A option, I think, towards the bottom of your screen. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide feedback to us and comments on today's seminar. So now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so they are equipped and prepared to protect the health of communities across the country. NEHA supports the environmental public health workforce by striving to provide the most up-to-date trainings, tools, and resources across the many fields considered environmental public health. NEHA supports building workforce capacity, efficiency, and effectiveness by focusing on increasing knowledge, skills, and competencies across all environmental public health fields. We also have a long-standing history in credentialing. For example, we have our Registered Environmental Health Specialist, or REHS credential, and our Certified Professional Food Safety, or CPFS credential. And there are many more. Our credentials are evidenced through testing and maintained through continuing education. So if you are not already a member, you should join us today. We'll drop the link for membership in the chat in just a moment. In addition, we host an annual educational conference and exhibition, which includes hundreds of sessions focused on the different fields of environmental public health, like food safety, private water, on-site wastewater, vectors, climate, excuse me, air quality, emergency preparedness and response, body art, and so many more. This year, we are hosting our AEC in Phoenix, Arizona, on July 14th through the 17th. This year's conference promises to be your oasis in the desert. Registration is currently open, and in fact, you can get early bird registration pricing through April 25th. Full conference rates include tickets for our exhibition grand opening and our networking event. Now, without further delay, allow me to introduce our guest speaker. So our guest speaker today is Talisha Bacon, who works at the Utah Department of Agriculture and Food as the Recall and Utah Rapid Response Team Program Manager, where she responds to foodborne illness outbreaks for human and animal food. Talisha is also a licensed environmental health scientist. She currently serves as a member of the NEHA Preparedness Committee, is a co-lead on the AFDO HP 2030 norovirus Environmental Health Assessment Tool Subgroup, is a mentor for the NEHA Mentor Program, and sits on the steering committee for Partners with a Common Purpose. Talisha was also part of the first NEHA Leadership Academy cohort. Talisha received her master's degree from Westminster in public health and her bachelor's degree from the University of Utah in exercise and sports science with a minor in nutrition. When Talisha is not working, she enjoys baking, crafts, traveling, and spending time with family and trying out new restaurants with her husband. Talisha, the floor is all yours. I will stop sharing and you can share your presentation.
All right, thank you for having me today. I just want to start off by telling you a little bit about my story of how I became the Utah Rapid Response Team and Recall Program Manager. So while I was doing my graduate degree in public health, I was introduced to the field of environmental health by one of my professors. I didn't know at the time that this field existed. I didn't know what it was, but I definitely just grew a big appreciation and interest, and I've learned to love this field. So I did my practicum at a local health department and later got hired at another local health department and worked in the environmental health department. In a few months, I got my license as an environmental health scientist. I did that for a couple years, and then I did a different position still at the same health department, the same division, as a medical healthcare surge coordinator for 2 counties, where I worked with hospitals, long-term health centers, and other medical establishments to help them prepare for disasters and emergencies. Then there was another opportunity at the Utah Department of Agriculture and Food that combined environmental health and emergency preparedness, the 2 fields that I really enjoyed, into one position. And long story short, I got the job, and I've been at that position, which was the Utah Rapid Response Team Program Manager and recalls, for the last 5.5 years. So it's been a very fun, educational, and rewarding position. So what is the Rapid Response Team Program? Up here, it shows a map of the U.S. and it shows, so the Rapid Response Team is the national program that's funded by the FDA. And the states in blue are the states that have a Rapid Response Team program. The ones in light blue are the states that just got the program last year. And then the ones in green are states that have the program, but that don't receive the funding from FDA. So the Rapid Response Team program is basically just be able to respond to human and animal foodborne outbreaks faster. And we've been able to do that time and time again here in the state of Utah. Through the Rapid Response Team program, we're able to provide trainings and conferences statewide, respond to outbreaks, which I've mentioned. One of our conferences that we organize is called the Food Safety Conference. We started this a few years ago, and it just exponentially gets bigger every year. Last year, we had 325 people attend, about 7 exhibitors, people from 14 other states, and so we get to do a lot of fun events like that. Also, within my job, we work closely with state, local, and federal partners, including the FDA, USDA, the local health departments, industry. We have a tribe liaison, and many other organizations. So this picture here up on this screen shows the Utah Rapid Response Steering Committee members. And we meet about once a month. We actually meet more often than that, but at least once a month to coordinate what's going on in the state about food safety, outbreaks, and things that we need to improve on. So you can see on the list, we have like our state chemists, we have our enteric epidemiologists, our dairy program, retail manufactured foods, our produce foods, our state health, public health, veterinarian, our state chemists, local health department representatives. It's a very diverse group that we work with, and it's a lot of fun. So some of the skills that I use in my job, and there's a wide range of skills, but these are just some that I was going to highlight today. They are creating trainings and materials for conferences, leadership skills, budget management, grant writing, people soft skills, collaboration, coordination, being organized, being flexible, doing customer service. People always ask me, they're like, what is your day-to-day job like? And I'm like, oh, that's so hard to say because every day is so different. But I always like have a plan of what the day is going to be like. But I've just learned over the years that when I go to work, I throw that plan out the window because there might be an outbreak or a recall or something else that you didn't think was going to happen. But when we get those foodborne outbreaks or recalls, that becomes our top priority. And then we meet with our team and we figure out what we need to do and the next steps that we need to take to be able to help mitigate those responses. So some of the challenges within my position is grants, politics, and dispelling myths about food safety, and then always being in the background. A lot of people still are not entirely sure about what environmental health is or what exactly it entails, and that is slowly being worked on, and I think it's getting a little bit better. But it's still kind of a challenge. But the job that I have in the position with working within food safety and public health, it is a very rewarding. It's very rewarding. I really enjoy it. So you're able to protect the public. You're able to educate the public, and the biggest thing is knowing that you make a difference at the end of the day. So there's a lot of many different avenues that you can take within this profession. The sky is really the limit. You could probably create your own position or, combine different fields, which is what I was able to do. But you can be an environmental health scientist. You can do an epidemiologist, work in a laboratory, be a food safety lawyer. I've actually had the opportunity to hear from Bill Marler, and he actually came to speak at one of our conferences, and it was fascinating. You could do a lobbyist. You could work in the private industry, be a microbiologist, a chemist, a safety director, work in academics, toxicologist, a consultant. There are just so many options that you can do. But regardless of what your path that takes you to what you want to do, there's three key components that I just want to share with you that have impacted my career, which is pivoting, networking, and opportunities. So the first one that I want to talk about is pivoting. Don't be afraid of change within reasonable bounds. You'll always need to be able to change and adapt to new requirements and learn how to make your position stronger will give you an upper edge. So find a way to make what you want to accomplish. There's a quote that I really like. It says, "The journey of 1,000 miles begin with one step." So your career goal, whatever it is that you're working on, it only starts with that first step of courage. So just take it. Today, write down one step to accomplish to reach your goal. Recognize the potential that is in yourself and move forward. The next component is networking. Get to know people in your profession and other professions is very beneficial. I never would have imagined a job that would be able to combine environmental health and emergency preparedness, which, as I mentioned, is what I currently do. And this position actually didn't exist in the state of Utah until about 6 years ago. So that's a little fun fact there. But networking, I get it. Some people don't like it. Some people thrive on it. Some people just, it's there, right? But it can be scary and very intimidating to some, but just start small and this will build your confidence. If someone doesn't want to network with you, try not to get discouraged and just move to someone else who appreciate your time and effort. And that is where, excuse me, that is where the unexpected opportunities and achievements come from, is your persistence and your determination. Also try to avoid being intimidated by someone else's title. If you want to approach them, go for it. It doesn't matter if they have a higher title, a lower title, the same title. Just never think that you can't network with someone for those reasons, because you'll be surprised at what you learn from them. My mom always says if you haven't learned something new from talking with someone, it was a missed opportunity, and it is so very true. The third thing that I want to talk about on is taking opportunities. Don't be afraid or think that you can't go for something. The worst thing you could do is not try for it. Where I am today is from taking multiple opportunities that others didn't want. Always be working on ways to improve your skills through courses, certifications, and training, but be proactive and take initiative. Keep an open mind on unexpected career paths or roles, and apply for roles or promotions even if you don't have all the qualifications. You have the potential within yourself, so realize that potential and just act on it. So for the next few minutes, I just want to show you some pictures of my career over the past 10 years in environmental health and kind of some of the things that I've done. So you can see up on my screen, there's this ice machine up here. And so there's a buildup inside an ice machine. There's some buildup over here on some soda nozzles. You can see that the hand wash sink is being blocked. So you can see that the equipment hasn't been cleaned at the restaurant. These are all pictures from some of the restaurant inspections that I've done. Here's some more pictures. You can see some meat juice spills, some gunk around the drain. There's fruit flies, there's ants, there's chickens not being hot held at the right temperature. There's lots going on in these pictures, right? Sponges are being used, there's cross-contamination, there's no sanitizer, there's food stuck on carts, there's an establishment making their own wine. You never know what you're gonna walk into. But some other things that I've been able to do throughout my career is able to participate in hospital emergency response training. There's environmental sampling during foodborne outbreaks, responding to algal blooms at Utah Lake. I got to fly in that small plane and go over the lake and figure out where the different points of the algae were. Trained with the canine search and rescue dogs during a search and rescue exercise, speak at universities, speaking at national conferences, organized conference and trainings, which I alluded to earlier. This tent right here, this is one of the equipment that we have. It's a temperature controlled incident command center that can be folded up and just put into a trailer. It has locked windows, locked doors. You can put a whole office inside. So we've used this a couple times for trainings and for outbreaks, and it's really cool. We also do posters each year highlighting what we have done throughout the year. And in 2023 at our national conference, we got first place on ours. I can still brag about that one. And then we also have this dead end ultrafiltration system that helps different pathogens for water. When we were doing that outbreak on E. coli 0157, we've also responded to a thallium in meat incident, a salmonella 4I- outbreak. We were able to work with some farmers in Utah and do a training in a watermelon field, which was a 2-day event in August, which was really awesome. We also responded to a STEC outbreak, a salmonella enteritis outbreak, a salmonella Newport outbreak. During the earthquake that happened in Utah in 2020, we worked with the FDA and did over hundreds of damage assessments to restaurants to make sure that they had the proper power and electricity and functions to make sure they could still operate after the earthquake and be safe. We also helped grocery stores with guidelines during the COVID-19 pandemic. And then these are other outbreaks that we've responded to. This is a picture of inside of our trailer that we have all of our equipment that we can just hook up to a vehicle and respond to where we need to go for outbreaks, and it's full of supplies and equipment. So in a nutshell, this is my contact information, but in a nutshell, that is what I have done over the years in different positions, but currently now as the Utah Rapid Response Team Program Manager and Recall Manager. And I just want to sum up with this one line that says, remember, at the end of the day, be who you are and excel at it. So thank you for your time. And if you have any questions, I'll be happy to answer them.
That was great. Thank you so much, Talisha. Those photos are just amazing. All the investigations you've been on. Wow. Um, Everyone in the audience, please use the Q&A if you'd like to ask Talisha any questions. Talisha, I actually have a question for
Yeah.
you. I'd like to know, in your experience responding to foodborne illness outbreaks, when you're responding at the onset of an outbreak, what actions have you realized to be like the most critical um, to conduct immediately?
Yeah, no, that's a good question. So we would never respond to an outbreak just by going on site, right? You got to make sure that you have the proper partners in place and coordination. So when there's an outbreak, we actually meet with all of our partners who are involved, potentially involved in that outbreak. So like our labs, our epidemiologists, our local health departments, and we'll have meetings and just collaborate and be like, hey, this is what's going on, and this is what we need. How do we proceed? What do we do forward? Do we need to just have the inspector go into the establishment and just touch base with them? Do we need to do an environmental assessment? There's a lot of different things that we go through depending on the outbreak and the severity of the outbreak.
Wow. Wow, it's your job sounds very exciting.
It's a lot of fun.
Oh, we do have a question from the audience.
Yeah.
They are asking, can you please discuss how you are involved from an environmental health standpoint during an emergency response like flooding, fire, etc.?
Yeah. So my position right now, currently, I also work hand in hand. One of my coworkers, he tag teams this program with me. He sits at the Emergency Operations Center, and we sit at the desk of the Emergency Support Function 11, which is food and water. So all that means is basically we have, in the event of a disaster and emergency, we can just work with our Emergency Operations Center and say, this is what's going on. We already have that relationship and those connections, and we attend monthly meetings, and then we're able to get resources of what we need to be able to divvy out what needs to go where.
Great. Thank you. Another question we have is, what are the biggest challenges your team faces during an emergency response?
Oh, yeah, these are all great questions. Probably, okay, there's a handful of things that I can think of, but one of the challenges is just making sure, like, oftentimes you want to rush in and just kind of solve the problem, right? You want, like, hey, let's just go take care of this, let's get this done. But you often have to kind of take a step back and make sure you have everything to be effective and efficient before rushing in. And so that does take a little bit of meetings, coordination, but it's way more effective at first, because then you can just, when you get on site, you have everything that you need to respond. So I'd probably say don't just like rush into things. Make sure it's a little bit more thought out, methodical, and then respond.
Great. Another question for you. How does a state start a rapid response team?
Yeah, that's a good question. That is, so there is it's funded through the FDA. And so we have the FDA contacts who are over that program. And I can give those to you if you want, but it's really just kind of simply contacting those that are over the program and say, hey, I want to start this program. And it's usually, there's a couple metrics that you would have to do within your state, like you have to have so many of the standards completed. But their goal is to have all the states have an RRT. So I'm sure I don't know who asked that question, but I'm happy to work with them and direct them to where they need to go if their state is interested.
Very cool. I'm sure FDA would like all 50 states to have a program.
Yeah.
Yeah. We have time for one more question before we move to our panelists. Can you tell us about the most interesting foodborne illness outbreak you've done?
Um,
You have so many to
there's
choose
so
from.
many. Yeah. So I think one of the most interesting ones was probably one of those ones that I highlighted up here on my screen is that we went, it was a place that was making the wine. They were also bottling a lot of food, and they had chicken stuck to carts. It was just a mess. It was, they're actually no longer in operation. We always like to try and work with restaurants. We don't ever like to see them close, but there was a lot going on that one.
Wow. Wow.
Yeah.
All right. Well, as I mentioned, we have to move on in the seminar. Talisha, if you would check the Q&A, because there are additional questions there that you could respond to.
Yeah, I'll respond.
Thank you very much. Thank you for your presentation.
Yeah, you're welcome. Thank you for having me.
Of course. All right, let me share my screen with all of you again. All right. Adrian, can you just confirm that that came back up for everyone?
Yes.
Thank you. All right. Well, today we have 3 expert panelists who are going to talk about their day in the life of food safety. We have Michele DiMaggio, who is a supervising environmental health specialist with Contra Costa Health, Environmental Health in California, and she manages multiple consumer protection programs. Michele is also a National Environmental Health Association second vice president and an EPI Ready course instructor. She volunteers her time as a local regulator for the Partnership for Food Protection Governing Council, IFPTI, National Curriculum Standards Framework Development, AFDO Healthy People 2030 Norovirus Work Group, Council to Improve Foodborne Outbreak Response, and the Conference for Food Protection Council 2 and committees. Next, we will have Tia Glave. She is the president and co-founder of Catalyst LLC with over a decade of experience in large and small food manufacturing, food retail, and startup food environments, including supporting iconic General Mills brands like Pillsbury and Yoplait. She is a chemical engineer and a certified master coach. She is HACCP and Seafood HACCP certified, FSVP trained, a PCQI, which Tia, you will probably need to explain what that is, and has led teams in FSQ, sanitation, laboratory services, operations, and maintenance, and has served on global policy teams. Tia founded the Black Professionals in Food Safety and Quality Networking Group to mentor and grow Black talent. She is an active International Association for Food Protection, serving as the Retail and Food Service Professional Development Group Chair and the Food Safety Culture PDG Vice Chair, and is an advisory board member for QA and Food Safety magazine. She is a member of the International Coaching Federation and a member of NEHA's Food Safety Program Committee. Lastly, we have David Morales, who joined Maricopa County's Environmental Services Department in June of 2000 as a health inspector for the Environmental Health Division. He has performed health inspections in restaurants, hotels and motels, mobile home parks, swimming pools, and school grounds. David has served as a Hispanic liaison, training officer, supervisor, and managing supervisor for the Quality and Compliance Division. David currently manages the Eastern Regional Office within the Environmental Health Division. David received a bachelor's degree in zoology from Brigham Young University. He is a registered sanitarian in the state of Arizona and a REHS with NEHA. So now I will stop sharing my screen and we will begin with Michele DiMaggio, who's going to tell you about her life in food safety. Michele?
Hello, yeah, let me take myself off of, there you go. Hello, everybody. As Nicole mentioned, my name is Michele DiMaggio. It's been a long journey. So I actually started with my mom in the restaurant business. My mom owned a restaurant for 15 years. Didn't even think about getting into food safety, or my goal for her was being the owner of her restaurant. So I started actually as a business major. To me, I couldn't do business. I fell back in love with biology like I did with in high school, and so I got my degree in Bachelor's of Science in Biology. That took me on the road to where I'm now. Um, I started as an ag biologist, worked for a seed company, and then worked for vector control. Finally found my love in environmental health. And over the years, I grew into environmental health, but I knew that my love of outbreaks, emergency response like Talisha, um, was where I wanted to be. Through my years of working in environmental health, I actually saw some of the work that we do, even though, and I'll mention it later, it's behind the scenes. We are as environmental health, as food safety professionals, are extremely important in what we do. And I try to tell our team that every day is, you know, we got to remember that who we are and what makes us important. Um, my young life as in the restaurant industry helped me also to understand that point of view when I did my inspections. Because every so often I would think of my mom, and I'm talking to owner, I think about my mom who was an owner of a restaurant. So that helped me as a food inspector and communicating some of the violations or even some of the changes that can be done. Um, and now I'm getting close to retirement, but not truly close to retirement. I'm looking at where can I go from here? How can I put out there that environmental health, food safety professionals is a career that is very valuable. And that's what I would hope to express to you today. So thank you for your time today. And I look forward to some of the questions we have for you.
Thank you, Michele. And next we will go to Tia.
Hello, everyone. My name is Tia Glave, and I am a chemical and biomolecular engineer and pre-med graduate from the University of Tennessee. And I stumbled my way into food after realizing that I was not passionate about the oil and gas industry or the chemical refinery industry, and I wasn't sure what type of doctor I wanted to be. I decided to just search for a different job. And I was fortunate enough to attend the National Society of Black Engineers, or NSBE's, very large annual conference and participated in their job fair. And there I had the opportunity to talk to many organizations, but food definitely stood out. And in particular, General Mills, where I started my career in food, stood out because of the people that I met. And I didn't have the words to explain it at the time, but I was seeing the company culture through the people I met, and it spoke to me. So I randomly decided to go into their quality assurance rotational program, had no idea what it was, and fell in love with food and leading people in food. And since joining the food industry 13 years ago, I have had the opportunity to lead in food manufacturing, food service, e-commerce, and I've touched most food categories by either working directly with an organization or through consulting. And a day in my life during manufacturing or food retail or food service could be solving food safety or quality problems, such as creating and updating global policies, eliminating waste, starting up a new production line, or rolling out a new system. But all of my days included connecting with people, understanding how they do their jobs and how I can help remove barriers for them, educating them about food safety and the impact of what they do have on our consumers. Sometimes I'm a therapist, sometimes I'm a coach. And as I grew in my career, I realized that connecting and building relationships with people became more and more important. And I noticed that even though each function, like food safety, maintenance, engineering, had strong technical backgrounds, people struggled with leadership, building relationships, communication, managing conflict, influence. And I realized that in order for technical leaders to be trusted business partners and influence the organization, we must learn leadership skills. And so this passion around leadership and culture led me to becoming a certified master coach and co-founding my organization with Jill Stuber, Catalyst Food Leaders. And our mission is to transform how people lead in food so that they are empowered to live authentically, achieve more, and enable business growth. And we truly believe that there is no business problem that cannot be solved with better leadership. So as you are thinking about your next steps, I encourage you to prioritize your own leadership development, even as a student. You have technical knowledge and you will continue to learn and become stronger technically. You must also focus on strengthening your emotional intelligence. And this is the time to build those skills through learning, practice, and reflection. Because being a leader isn't about a title or how many people you manage or lack thereof. It's about each member of the team being empowered to make the greatest impact they can make. So I'm excited to be here today and to share and to learn from you all and the panelists, and I look forward to your questions.
That was such wonderful advice, Tia. Thank you. And last but not least, we have David Morales, who will share his story. David?
Yes, thank you for having me. It's good to be here with you. And again, I appreciate the invitation. My name is Dave Morales. And yeah, my story, where do I start? I also, like Michelle, grew up in a restauranting family. My grandparents came to the United States in 1962 and went straight to Utah and opened up Mexican food restaurants there in the valley. And operated for over 55 years. And so as a young kid, it was in 8th grade when I started cooking at the restaurant, and I cooked for about 14 years. I was kind of a shy kid, so I always kept at the back of the house. But as I grew older and got more confidence and found who I was, I ended up going to the front of the house after I started cooking for 14 years and started to get into being a server and finding out what the front of the house was like. I heard so much about tips and wanted to be a part of that. But I was in school. I was actually pre-dent, so I was going to go to dental school. But I always knew my health inspectors. They're always there at the restaurant and said, "You ought to come work for us." They knew I was in school. Our restaurant was actually right across the street from the university. So they were like, "Hey, you should come work for us." But I was going to go to dental school, and it wasn't until I started to get into the end of my 4 years that I realized, I already had 2 kids and one on the way, and money to go to dental school was looking like a lot of money, and decided to pivot. And I knew that I could always become a health inspector, and so I decided to do that. I was trying to stay out of the cold because I was already in Utah and in the cold. And so I started to do some research and found that Maricopa County was doing some really good things. So I came out here in 2000 and started working for them. I came in as a health inspector. I was doing restaurant inspections mostly, but pools and hotels and motels. My first 5 years, I was thrown into kind of one of the hardest districts here in Maricopa County. Everybody used to tell me, you can only go up from here. And I learned so much working those 5 years in that district. And in that district, I also had Phoenix Sky Harbor Airport. So I also had the airport and learned a lot there in the airport as well. But I found out one of the best tools that I learned on the job early on that I thought was very valuable is, besides just having a science degree that you need to get this job, was the ability to communicate. Communicating with people, de-escalating, relating with people, and being able to speak to people at different levels, to chefs, to cooks, to kids in high school. They all work at food establishments, to low income, to higher income, to Asian, to Latino, to Indian, and the various backgrounds that people come. And so I realized really fast that I had to hone in my skills, and I got really good at drawing when I couldn't communicate verbally, but I absolutely loved that. Um, I then became a language liaison. I speak Spanish and absolutely loved walking around with other inspectors and helping them train the Spanish speaking establishments, translating materials that we already had in English into Spanish. And as I started to translate, I realized that there were some things that were translated in English, but were not available in Spanish. Things like al pastor and making pork rinds and all of these things. So I started creating things. And as I started to create things and see those things implemented into the department, I realized, oh my gosh, I can come up with ideas. I can develop those ideas and implement them. And that for me was the best thing ever. And so I started to do that. Shortly after, I became a trainer where I love teaching. I love talking to people. I loved learning. And so that was right down my alley. I love being the first face for those people that were coming into Maricopa County and give them that positive, reinforcement as they came in. Then I started to get standardized. I tell you, I learned a lot. So I became standardized by the FDA. That's where you go out with the FDA and you do inspections, and you have to meet their criteria and make sure you're up to par. And I had a really good mentor in a person named John Marcello, who's really well known nationally. Just retired from the FDA, but I was standardized and re-standardized a couple of times by him, and that was such a great experience. I continued to create documents, and I started looking at processes and realizing, wow, well, maybe I can make processes better. They're existing, and some of them have existed forever, and being able to make them more efficient. And so I started looking at processes, and that even gave me more push to kind of look at things and think outside the box, and absolutely love that. And then it also gave me an opportunity to manage people without truly being a supervisor. I was in charge of managing all the new hires, and that was a great opportunity, and it set me up for becoming a supervisor. I really learned a lot being a supervisor, how to manage people, how to resolve concerns, how to coach, etc. I loved removing hurdles from staff. If they had an issue, if they needed something and they couldn't get it, I loved stepping in and being able to get something for them and remove that hurdle. So I really enjoyed being a supervisor. I had a really good mentor, which was our division manager at the time, who really took me in under his wing, and, talk about networking and having good people around you. It really, really helped me out. So all those things, and then, becoming a manager, and then being able to not only supervise staff, but then supervisors, start to become a speaker nationally. All those things were great. So I really love the fact that I get to protect public health, that this job is dynamic and it changes, that it's got a work-life balance. It's amazing. All of those things I've really enjoyed over my career. And I'm also looking forward to your guys' questions. Thank you so much.
Thank you, David. Thank you for that. All right, we have a question. If all three panels, Michele, Tia, and David, if you'd like to turn your cameras on and unmute, We're looking at about 12 minutes left in the seminar, so let's get going here. From the audience, are there leadership, communication courses, certifications that any of you could recommend?
Great
Well, yeah, great question. Go ahead.
I'll start and just talk about catalysts because what we do is specifically for the food industry around leadership development. And we only focus in the food industry because myself and Jill, we have years-long experiences across the industry. I did not mention poultry, the poultry industry, meat and poultry. I have very limited experience with USDA, but Jill has that was her full career with very limited experience in FDA. So we cover the food industry in terms of our backgrounds, and that helps us connect the leadership skills to practical solutions that food industry leaders can use within their locations, wherever they are. So we help anyone in the food industry as well as students. We are venturing into the student space because we know it's so important for people to come into the industry, but also into academia, right, and into government with leadership skills. So I'm happy to have a conversation with those who are interested. But of course, there are also other leadership certificates and groups out there, and we didn't invent leadership skills, right? Most of us, we talk about the same thing. We're just able to relate it to the food industry because we've worked in the industry for many years. Michelle, I know you had some thoughts.
Oh, I was going to advertise for NEHA. So, so NEHA has on their website certification and credentialing website. So there's multiple certificates in there. IFPTI, International Food Protection Training Institute. They also have multiple certificates on there. And if you just want to know what kind of laws or education people would need, starting out, you can just start with a food handler card, which is $10. Or if you want to do the whole 8-hour class of food safety, food safety professional, food safety, CPFS, which NEHA also offers, just to get familiar with what does it take, what information. And Adrian put the website on there, so take a look. But David, do you have anything?
Yeah, I would say start now, talk to your peers, talk to your professors, get to know people that are higher up than you and talk to them. Get the courage to do that and to network. As Talisha was saying, in Maricopa County, we have our own university. So you can actually come into Maricopa County and go through a bunch of courses that we have available. If you want to learn Excel, if you want to communicate better, we have a whole list of courses that you can take. So some counties do offer training for their staff. And so there's a lot of opportunities sometimes when you join an organization as well.
And if I can add, I don't know if we'll have time for a question later on, but I was going to say, reach out to your local jurisdiction like Maricopa, wherever you are, whatever state, are local. For example, here at Contra Costa, we offer ride-alongs. I'll talk to people on the phone. I'll refer them to what does it take to be a California Registered Environmental Health Specialist. Shadowing an inspector, going out with an inspector. Some jurisdictions do that.
Very cool. While we await, feel free to drop questions in the Q&A, anybody who has a question. Michelle, in your experience, how do food safety professionals collaborate with other public health experts like epidemiologists, environmental scientists, and community leaders?
Well, I like what Talisha's presentation gave a great example. We are public health, so we work closely with public health, laboratory, everybody who may be involved, foodborne outbreak, or sometimes, and there are jurisdictions that do others, like Legionella. Many of us across the country were involved with public health in COVID. I was in public health during COVID, so we can switch. We're very adaptable. And especially when it comes to foodborne illness outbreaks, which Talisha mentioned, we work very closely with public health to find the root cause and to prevent future people from getting ill.
Let's see. David, on a typical day, what are like your main tasks and responsibilities that you focus on?
At my level now, I come in and I come into the office and I make sure that staff are kind of make sure that supervisors are overseeing their staff, making sure that they have districts and know what they're doing as far as inspections and being efficient. I have meetings. We're always looking forward to the future and where we're going with the division and things that we're trying to accomplish. We're always trying to look at the mission and vision of the county as a whole and make sure that we're falling in line with that. Also look at budget if people want to go to conferences and things like that, or if I need to order supplies for the office. These are all things that I'm involved with. And then if there's anything where we have an establishment that's having a really difficult time, whether it's legal action or they may lose it on one of our inspectors, then I have to bring them in and meet with them and have those conversations. And then just having normal meetings with my supervisors to make sure that their staffs, have what they need. And, there's employee issues sometimes that arise and you have to address those and things like that.
Okay, thanks, David.
You bet.
Tia, I wanted to ask you, so knowing students are obviously working on their degrees in school, what other things could they be doing to help prepare them to enter the field of food safety?
Great question. I love what Michelle was saying on doing ride-alongs,
Mm-hmm.
shadowing inspectors if that's what you're interested in. If you're interested in going into industry, there's internships or co-ops that you can do where you get that industry knowledge and experience that can help build, even if you decide not to go into industry, right? That experience will help you in your future career and kind of help you decide where you might want to go. So I definitely encourage doing internships, volunteering in food spaces and learning about how each of the industries work so that as you enter the industry, you actually have, or academia, government, you have more knowledge around it and you're able to say, this is what I like doing right now. So let me try it. And always know, like Talisha, her presentation was fantastic. You can always pivot, right? You can always take on a different opportunity if it's not the right fit.
Yes, absolutely. Due to time running low, I'm going to ask the panelists to keep an eye on the Q&A and respond to any questions that are in there. And now I am going to share my screen again and pass the floor to Adrienne Gothard here at NEHA, who is going to address the students that are with us today.
Thanks, Nicole. Well, hi, everyone. As Nicole mentioned, my name is Adrienne, and I oversee all of our student and early career initiatives here at NEHA. So if you have any questions or ideas about how NEHA can support you or your university, please let me know. I'll drop my info into the chat here in a second. And really quickly, just wanted to go over some of the things that NEHA offers for students. We do know that an estimated 40% of the environmental public health workforce today plans to leave their jobs in the next few years. So NEHA really has always had a focus on supporting the development of environmental public health students that are seeking to enter our workforce. For example, with our annual undergraduate and graduate scholarships, which we gave out more than $18,000 last year. So NEHA's focus on students has become a key commitment to building the next generation of the workforce who is trained and prepared. So we have enhanced our focus, offering, like I said, the academic scholarships for graduate and undergraduate students. We have a student research competition. Of course, like today's session, we have our campus grand rounds that offer the opportunity for students to engage directly with experts in the field. We have mentorship opportunities and access to our community of over 7,200 members, career building and professional development resources, and many more to come. So we are currently offering a free 12-month NEHA membership for students if you join before October 2025. So I will drop that information here in the chat. You can either scan that QR code, or we have you can go to www.neha.org/students, scroll to the bottom, fill out the quick form, and you will get access to a free 1-year NEHA membership. So thank you again so much for your time today, and thanks for being here.
Well, that's exciting, Adrian. Free NEHA membership. Absolutely. All right. So really quickly, I hope today that you'll be walking away with some new knowledge on various roles that make up food safety workforce, that you're able to compare and contrast some of the responsibilities, the challenges, and rewards of different food safety roles, and that you're better equipped to assess if food safety is the career path for you and what that align with your personal interests. And lastly, in our last final minute, we would like to give a big thank you to our food safety experts, Talisha Bacon, Michele DiMaggio, Tia Glave, and David Morales. And thank you to all of you who joined us today. I hope you gained new insight into the field of food safety. We have one final request of each of you who joined us today, and that is if you could take 5 minutes to provide us your feedback on today's seminar by completing our short evaluation survey. Your feedback is much valued and assists us in being better able to meet your needs in future seminars. It would be greatly appreciated. You will receive a link following the close of the seminar. So thank you again. Wishing you all a wonderful rest of your day. Thank you. Goodbye.